and I did gain back 3 or 4 pounds, and I called. He said that's not that critical, but you got to be very careful because I kind of plateaued a little bit, but now have lost that weight, so I'm down to about 235, 237. So I've lost overall about 50 pounds.
Wow,
so
that's awesome.
Yeah.
What is one of the challenges that you and your wife face in your daily life, functioning in the community?
In the community, well, probably the biggest thing is we'd like to go out to eat.
Okay.
You know, because it's when you eat, I'm going to say normally, it's easy to go to the restaurants and one of my favorite restaurants in 99 or the Great Imposter or something like that. Well, you can't do that. We can't do that because and what makes it very difficult is going out there with family or friends. They are ordering prime rib and they're ordering this. And the most I really can get out there is a garden salad, and most times they might have a fat-free dressing, but most of it's not fat-free. It's low-cal or whatever the case may be. So the difficulty is, for me, is to go out there and find go out to be able to have a nice dinner with people and find a good meal. What I call a good meal is what I can eat. And that's the difficulty. So when we go to a restaurant, the most we can do is maybe go to the salad bar and have a salad, but then I can't have the ham, I can't have the egg, and I can't have the dressing that they have unless it's vinegar, straight vinegar or something like that. So the real challenge is going out and finding a place where somebody like me that's trying to stay on the straight and narrow can go out there and have a dinner. Because what happens is, and this is a very challenging program that we're on, a lifestyle that we're on, is to continue maintaining it. Because you get tired of sitting at home, and she gets tired, I'm sure, and again, from having to cook for me all the time.
Well, I'll tell you, Chet, we're addressing that right here in Brunswick, Topsom, Bath area. Right now we have a program that we're going to the restaurants in the area, and we're saying, wouldn't you like to put on your menu an item that will not only taste good, but reverse heart disease, reverse diabetes, and let people like Chet come on out and have a really tasty meal with his friends and not have to worry about dropping dead in the restaurant.
Absolutely. And going along with that thing too, Tim, and that is, I come in contact with a lot of people. I have a large family, but also because of the programs I'm involved in, boards and committees, I meet a lot of people, and they're impressed with how what's happened to me. And
they should be.
And when it first happened, they said, "What's the name of that book?" So they went out and bought the book. Well, eventually, I told so many people, my wife told so many people, that they would come back and say, somebody had mentioned at Walmart or Bookland, I can't remember at the time what it is, what's going on, because I can't keep this book on the shelf. So a lot of people have jumped on board. But the biggest thing is that they can't stick with it very long, because I mean it's a radical change. They have said to me many times, if there was a place I could go to eat like that, it'd be a lot better for me. You know, maybe we go 2 or 3 times a week, or whenever we want to go out. If there was some place that they could go to do that, it'd be a lot easier. And then I think that once they do that, they could start doing it at home. But the challenge again is finding a place to go, or to be able to get past the first 2 weeks. It's very critical. If you can stick with the first 2 weeks and stay away from portobello mushroom burgers, you'll be all right.
Okay. Well, it sounds like you've had a radical change, but you're very highly motivated because, as the good doc said, you want to live.
Yeah, well, absolutely. And I want to, and I hope that I can be an example for people out there who are just like me, who feel like they can't do it. And very quickly, as I told you, boards and committees, I'm on the school board too, RSU1, and we're trying to reach kids at a young age. That's where it really is important, reaching with a young age, so that when they get to be 55, 56, 57, and even younger than that, in their 30s today, they're not having the heart attacks, strokes like that I'm having.
Chet, thank you so much for joining us today. Dr. Howe, it's always a pleasure. And thank you for being willing to share your message and share your experience.
Absolutely. And anybody who wants to know more, don't be afraid to call me.
Very good. And thank you for joining us today on Healthy Living. We have a number of topics that we've covered over the past, and coming up soon is going to be a show on the work, the initiatives that are going forth in this particular community in working with the restaurants. As Dr. Howe mentioned, there's a lot of energy and work that's gone into that. So stay tuned, stay tuned to the program, because you'll be learning more about that. And in our local community, there are some options related to learning more about these types of programs. At Parkview Adventist Medical Center, we have the Lifestyle Choices program. If you're struggling with some of these problems, heart disease, diabetes, that sort of thing, I'd encourage you to look into that program. If you would like to learn more about the Healthy Living Show and programs that we do, please feel free to call us. Our number is 373-2162. Again, 373-2162. I'd also like to add that if you have a topic that you would like us to cover in the future, please feel free to give us a call and give us your feedback, because we want these shows to be meaningful and helpful to our community, and we want them to cover topics that are of interest to you. So we thank you for joining us today on Healthy Living, and we look forward to having you joining us on a future show. Take care and have a great day. Dr. Howe, in a critical state like Chet's, is diet really enough?
I would not use diet alone in someone who's just had a heart attack and is at risk for another large heart attack. I think it's important to use medication. There are several types of beta blocker, one of the statin medications, especially at that first stage, and aspirin, and indeed Chet was on those. Will he need them forever? Probably not. He's done very well. He's been very careful with diet. But if you have symptoms of a heart attack, make sure you see your doctor. They can help. They can make a difference. Medication does help, but remember, you need more than medicine often. Diet can be that extra step and can work miracles. It's amazing what you can do if you are committed to making a lifestyle change.